What if I told you that one of the most commonly missed neurological diseases can silently damage your brain and spinal cord for years, and that millions of people in the U.S. may have it without even realizing it? Multiple sclerosis, or MS, affects nearly 3 million people worldwide. And right here in the U.S., almost 1 million Americans are living with MS today. And its early symptoms can be so subtle, they often get dismissed as stress, fatigue, or just getting older. Today, we're diving into 7 early, silent signs of MS you absolutely need to know. These symptoms are so sneaky that catching them early can make all the difference for your health and future. And here's why you should watch all the way to the end. Because the earlier you recognize these warning signs, the sooner you can talk to your doctor, start treatment, and possibly slow or even stop the damage MS can do to your nervous system. By the end of this video, you'll be able to spot red flags most people miss, protect yourself from years of confusion and misdiagnosis, and take control of your health before it's too late. Quick note before we start. Everything in this video is based on evidence-based research and clinical studies, but it's here to inform you, not replace a doctor's visit. If any of these symptoms sound familiar, the safest thing you can do is talk with your doctor or neurologist. Early diagnosis can make a big difference. So let's get into it. Number 1 is numbness or tingling paresthesia. Have you ever felt a weird tingling or buzzing in your arm or leg? The kind that shows up out of nowhere and just won't go away? Or maybe one side of your face suddenly feels a little numb, like it fell asleep? That pins and needles feeling might seem harmless, but in some cases, it's one of the very first clues of MS. Here's why. MS can damage the protective coating around your nerves. Think it like frayed wires in a cable, and that scrambled signal is what creates the tingling, buzzing, or even tiny electric shock feeling under your skin. A large review published in The Lancet Neurology 2021 found that up to 50% of people with MS first present with sensory symptoms like tingling or numbness. If that tingling lasts more than 24 to 48 hours or keeps coming back, it's worth a conversation with your doctor. An MRI at this stage can sometimes catch MS before it causes more serious nerve damage. Number 2, vision problems or optic neuritis. Ever had your vision go blurry in one eye? Or even seen double for no clear reason? Maybe it even hurts when you move your eye around? That can be more than just eye strain. It could be one of the first signs of MS. This happens when the nerve that connects your eye to your brain gets inflamed, and those signals don't travel the way they should. The National MS Society reports that optic neuritis occurs in about 20% of people as the very first sign of MS. Don't just blame it on screen time. Persistent or one-sided vision changes need a doctor's visit. Number 3, extreme fatigue. It is not your eye stayed up too late tired. MS fatigue can hit suddenly and last all day, even after a full night's sleep. It's one of the most common and disabling symptoms, often appearing years before diagnosis. A study in Multiple Sclerosis journal found that fatigue affects nearly 80% of people with MS, sometimes years before other symptoms. If exhaustion is stopping you from doing normal daily tasks, it deserves attention. Number 4, muscle weakness or spasms. Noticing one leg feeling weaker than the other, or random stiffness that makes walking harder than it used to be. Maybe you started tripping over little things or struggling with stairs you used to take easily. That can be an early sign that MS is affecting the nerves in your spinal cord. A 2020 cohort study published in Neurology found motor weakness was a first symptom in nearly 30% of MS patients. If weakness or spasms last more than a few days, get it checked. Early treatment can prevent more damage. Number 5, balance and coordination problems. Ever feel wobbly, like the room tilts for a second, or you bump into door frames more than usual? Maybe you just feel clumsier lately, even though nothing else has changed. That can happen when MS disrupts the parts of your brain that control balance and coordination. It's like your body's internal GPS is suddenly out of sync. The Cleveland Clinic notes that gait imbalance is reported in roughly 25 to 40% of people with MS during the first year of symptoms. Persistent clumsiness shouldn't be ignored, especially if it comes with other neurological signs. Number 6, cognitive changes. MS doesn't just affect your body. It can impact your brain. Trouble concentrating, forgetting words, or feeling mentally slower can all appear early. According to a 2022 systematic review in Frontiers in Neurology, 30 to 50% of people with MS experience cognitive symptoms even in the early stages. If brain fog becomes constant, it's worth a conversation with your doctor. Number 7, bladder or bowel changes. Running to the bathroom more often lately, or feeling like you just can't hold it sometimes. Even occasional accidents can be an early sign that MS is messing with the nerves that control your bladder. A paper in Neurology, 2021, found urinary symptoms occur in up to 40% of patients early in the disease, sometimes before other MS signs are obvious. These symptoms are often dismissed as aging, but if they're new and persistent, mention them to a doctor. MS is not always easy to spot, but early diagnosis and treatment can slow its progression and protect your quality of life. If you found this helpful, give this video a like and share it. It can help someone you love get diagnosed sooner. And don't forget to subscribe for more science-backed health breakdowns like this one.